we bin people into two different treatments, right? We have a newly diagnosed AML patient, and they are either fit for intensive chemotherapy, meaning that they're curable and they don't have a lot of organ dysfunction and they receive intensive chemotherapy. And then we have our often older, more frail, elderly population that are not appropriate for intensive chemotherapy. And then, you know, for a long time, we would give those patients what we call just lower intensity therapy. So Vidaza or decitabine or low dose cytarabine were the standard of care. And so what has really changed a lot in the past few years is that there have been the approvals of several different targeted therapies, and also importantly, the approval of venetoclax in combination with Vidaza or decitabine or low-dose cytarabine. And so within the United States, that has really relatively quickly changed our standard of care for that population, where most, at least within the academic setting, I think a lot of patients with that kind of older chemo-ineligible population is getting oftentimes Vidaza and venetoclax. That older patients should not be treated because the treatments are more toxic than the disease, and that we know is not true. There have been many different kind of retrospective studies, studies looking at SEER data within the United States showing that patients who receive therapy actually live longer and live better, improved quality of life than people who don't. The median survival of AML without treatment is on the order of weeks. And then, so that is definitely something that is still a belief, less so with time as we have these newer kind of well-tolerated therapies. And then, the tolerability of treatment is important also. The thinking that all of the treatments we give is just too toxic, and we have now several different well-tolerated lower intensity therapies that are effective in combinations, and our patients are in remission, doing well as outpatients, and able to do the things they love doing. So it's been as a leukemia physician, the past couple of years has been really an exciting time because we have more and more patients doing well on therapy.